and Senior Hospital in UK and in Royal Free Hospital. And moving forward to today's presentation, today's presentation is much more.
Mute your mic.
I'm not quite sure. Sorry. Talking about today's presentation is a medical career webinar, and it is much more focused on the doctor who is planning to come over here in UK and also pursue the career. And if you guys have any questions, then please do drop on the chat box, and we will be answering some of the questions too. And I can also see some of the questions regarding the PLAB one. Is Rita, are you okay with questioning those, with answering those questions?
Yes, I'm okay.
Yeah, Sadiksha have asked, she's saying that, let me see, sorry. Is there any plan to make PLAB Prometric Center in Nepal? Since there are so many students trying for PLAB every year, if Prometric Center would be available in Nepal, it would help a lot.
Well, so
we have sort of answered that on the chat itself. So we'll explore that, and Paras has kindly suggested approaching the British Council. So we'll see what we can do about that.
Okay, all right.
So let me just answer that. I had asked similar question to UCLA owners when I was doing my OET, and they said they had started some speeches with British Council and British Embassy. Maybe someone can follow up with them to find out and let us know as well.
Okay, brilliant. So shall we move to the next presentation? So next presentation will be done by Dr. Anushruti Bista, who is working as an FY2 doctor in colorectal surgery in Ashford and St. Peter's Hospital NHS Trust. So she will be presenting on PLAB 2, which is the preparation and expectation. Over to you, Anushruti.
Thank you, Deborah. Let me just share my slide. Hello, good morning and good afternoon, everyone who's in the UK and in Nepal. I'm Anu. Those of you who don't know me, I graduated from Nepalese Army Institute of Health Sciences in 2018, and I've been working here since past 7 months. I did my PLAB 2 in March 2019, just before COVID, so there has been a bit of changes after that. And Bimal, who's one of the SHOs working here, appeared his PLAB 2 after the COVID restrictions and after everything changed after COVID. So he'll help me with some of the changes. So let's go into what PLAB 2 involves, how you can prepare, and what you should expect in while doing your PLAB 2. So I'll be covering a brief introduction, telling you what prerequisites are there, what to expect, assessment and scoring system, some of the tips from GMC, some of the personal tips I had found when I went through the PLAB 2 journey, some of the reads that I would recommend you should be doing after PLAB 2. And some of you might be worried about UKMLA changes, especially those who are students. So I'll be briefly exploring about that as well. Most of the things I would be talking would be direct quotes from GMC website, because there's no other good information website like GMC. So going into PLAB 2, PLAB 2 is an objective structured clinical exam. There are 16 scenarios, each lasting 8 minutes. There would be at least 2 rest stations. So now, since COVID, they have started 2 different places where they take exam. Well, I think one contains 2 and one contains 3 rest stations. Correct me if I'm wrong, anyone. The whole exam takes about 3 hours, and it is supposed to reflect real life. It could be a consultation, or it could be a scenario as an acute ward, but you're supposed to handle initial bits of stabilizing patient or initial investigation that you can do, because PLAB is focused on being an F2 doctor, and most of that you would see in PLAB 2 is something that you have already had done in back home. It's just different language, that's it. There will be 4 attempts that you can do for PLAB 2, like PLAB 1. So prerequisites, you should have passed PLAB 1 within 3 years. Before it used to be 2 years, like Rita already talked about. It costs £879 and booking it via PMC online account. What can you expect? So instructions and patient information will be outside each exam. So would be trying to read instruction. Like I said, 2 different places where they conduct exam, which is quite close. The Hardman Street is the new one, and it's supposedly very big, so they give you a bit longer time so that you can change your station from one to another, and you can have sufficient time to read the question. After you finish your 1 minute and 45 seconds or 1 minute and 30 seconds, there would be a buzzer going in to let you know that you need to enter the exam cubicle. Don't stand outside the station if you've not completed reading the examination instruction. You can go in, there would be another examination instructions within the station if you need to check. So you can just excuse yourself, ask them a bit of time to finish reading your instruction, and then go on with your consultation. Focus on what tasks has been highlighted in the station. There would be a timer to announce a 6 and 8 minute. After 6 minutes, you need to focus on management, because you don't want to lose points for your management. Candidates sitting on those 2 different venues would be going to different exam, and they will have different pass mark. In some so every station varies. In some there might be simulator and examiner, whereas in some there would be only simulator, and sometimes you'll be alone with a telephone. Telephone station should be similar to a real life telephone consultation, and you are usually alone in that. There would be various groups of station like you tackle in every day when you're working as a medical officer. So it can be anything from taking just history and managing those patients. For those station, you just ask for what your examination findings are, and sometimes they'll ask you to examine. So you just take permission to examine those patients. There could be range of scenarios like angry patients, psychiatric patients. You need to sometimes break a bad news very delicately. And sometimes there might be acute scenarios where you have mannequins or semen and you need to handle some kind of emergency. And some of those stations could be teaching to students or teaching to nurses as well. You would be tested in 3 different domains. One is data gathering, technical and assessment skills, where you would be assessed just before you go into diagnosis. So anything involving history taking, examination, practical procedures. Another domain is clinical management, where you need to diagnose the patient, explain what their diagnosis is, explain how you're going to manage those patients and what it would involve. And interpersonal skills is something regarding how you build up your rapport, how you're using your various questions like open-ended questions and closed-ended questions to do your consultation. And it will also involve the patient. It would also be about how you involve the patient with a discussion rather than you just talking about it, and about how you understand the ethical principles and how you answer the questions of patients, basically. You will be listed on various different clinical skills. If you lack on any of those skills, GMC would tell you that this is the bit that made you fail on those stations when you get to your exams. So understanding your scores, when you get those results of PLAB 2, the pass mark is determined by borderline regression scoring method, which is you need to, most of us when we appear in exam would appear in a linear line. Anyone who has deviated from those linear would be counted as two extremes, would not be included in the borderline scoring method. So on an average, what's the normal passing mark? That would be determined by borderline regression method. So what I'm trying to tell you is every station has different pass mark, and every day, even though the same station might come in on every day, it would be a different passing mark because it depends on how your colleagues are performing on the same day. And the examiner do not know your pass mark when they assess you. So you should be very free and try to do as best as you can. And if you meet or exceed totals, and they will also calculate a pass mark for each station and calculate the pass mark for that day. And if you meet or exceed the total score and pass a minimum of 10 stations among the 16 stations, then you achieve a pass. And if any station is cancelled, sometimes they have some stations to introduce new stations. So they are basically using you guys as a mock standard to find out whether those questions can be used to assess other people. So those stations would be cancelled, and your total pass mark as well as the station number you need to pass would decrease. This is a this is an example of how they score you. So they give you score on every station depending on those 3 domains that we just talked about. And if your total score is more than the pass score for that station, then you pass that station. And you need to pass in total of 10 stations, as well as you need to pass total of the minimum score required. So that's how you pass in your PLAB 2. So DMC says that we cannot give the feedback to every examinees. So these are some of the tips they have said they've observed from examinees doing wrong, and like you to have that in your mind when you practice. So you need to ask questions which are sensitive, which patients can clearly understand. Using back passage and waterworks is very common, which we didn't know about when we were Nepalese. So they use the anus and anal opening as back passage and waterworks as the urinary bladder and all that system. So that would be something new which you would be learning about when you practice for your PLAB 2. You would be expected to be whatever patient you see in DMC, because those are the standard you need to meet as an FY2 doctor. And they say that don't say everything you tell me will be kept confidential, because essentially you write them in your notes, and confidentiality means different to every person. So try not to use that phrase. Do not ask questions to ask questions. Something like asking about alcohol and smoking is very, very normal in the lifestyle here. So you don't need to ask permission to ask a personal question. And but if you need to examine them, then take up implied consent, because you are essentially going into their personal space. And don't ask the patient to see something in the internet. You can ask them to look into the NHS website, patient access, or you can also tell them that you'll print out a leaflet from NHS website, but don't refer them to the internet, find out more about their condition, and don't bring up senior in every consultation. And try and encourage patients to be more involved with every consultation. You can ask them if they've understood what they've what you've told them so far. You can keep on summarizing them, whatever you've learned from them, so that both of you are on the same page. If you're not sure about your instruction, like I said, you can go back into the room and look at the instructions, excuse yourself. You need to be very thorough about psychiatric stations. You need to find out if anyone is at suicide risk, which is quite common here. Don't offer analgesia. If someone is in pain, you can ask them if you need analgesia, but don't offer something you cannot give them at the moment. And if a child is being discussed, don't use they or your child or baby, just use the correct pronoun. And don't ask patient, what do you think the diagnosis is? Try to be very certain about what the question is asking, and do not involve something that would help you in that consultation. Like you had this test back when you came here or something like that. Don't use something that has not been given to you in that station. And know your emergency protocols like cardiac arrest, massive hemorrhages. Behave like you do in your normal life. Don't pretend things. Don't pass the tissue if they are not showing tears, and don't invade in the personal space. Personally, I had a patient who I was talking to, and they just told me, can you just step back? And I knew at that time that I'd fail in that station, and that was what happened. So try and be mindful of people's personal space. And try to be natural, have a natural flow. That's something I would tell you guys. And here, most of the things that I've included here is in the GMC website. So just go on the stage, go on the website and see whatever they have said, because most of the things I tell you here would be something that you would forget. So try and, when you're practicing, go on and reflect on those to see whether you're doing something in your practice and whether there's something you can modify. If you ask some question, try and follow it up. Don't be a mock. Don't be someone who's just rotted everything that they've learned during the academy. Try to use that as to be more fluent when you're talking in conversation, but be mindful what your patient is telling you on those stations. And once your timer runs out, you're not going at any point after whatever you speak after that. So just excuse yourself and go back to the lobby, go and read another question, and forget everything you've talked about in the past station. So this is a mock station that the GMC has said. So for example, if you see someone, this is a question that you see in the GMC as the front instruction. So they will say manage, and in this question they have said assess and manage the patient for someone who presented with a complaint of head. So in your 1.5 minute that you prepare, you're already thinking about this patient has presented with head pain. So you need to go through your Socrates, and once you find out whatever information they give you, you just need to follow whatever you think is appropriate for that station. So what GMC has said is you need to take history, again, your medical history, lifestyle, appropriate lifestyle history, identify if there's anything that patient is concerned about, listen to them, display empathy, that is very prudent for you. For your interpersonal skills, make a diagnosis and recommend any appropriate management, and want to do that professionally and fluently. And when you're talking about questions about pain in someone's head, don't go asking them about chest pain, because that probably is not going to yield you anything. You can just ask them, is there anything you're concerned about? If they are concerned about anything, they'll let you know. So my tip when I was practicing is be very confident, do whatever makes you confident, dress smart. When you're in a bunch of other 15, 16, 18 people that have come for the same exam, everything can undermine your confidence. So dress smart, be confident, even when you're feeling very anxious. Wear your sleeves as half sleeves, and don't listen to suggestions by other examinees on the day of exam, because most of the times they're trying to mislead you, because at the end of the day, they are your competition. Treat every station like it's a blank canvas, like it's a patient you're seeing in your OPDs. And whoever's talking, mute the mic. Okay, and don't discuss specific of your station when you come out, because if GMC knows about it, your GMC registration might be in jeopardy. Read your questions very carefully, and just be very mindful of your tasks, what they've asked you to do. Don't try to remember the scripts from your academies, because there is variation within the same station. Sometimes they'll ask you to just take history. Sometimes they'll ask you to do examination as well as take history. And sometimes within the history, like there might be some variation of chest pains that you do not know about. So just focus on that on that consultation. There will be some minor twists, like I said. So just be present on that day and do the best you can. Most important thing is practice. Don't practice to remember the station, but practice to be fluent, practice to be empathetic, and practice to listen to whatever your patient is telling you. Try to find different set of partners, because everyone has their strengths that you can learn from, and try to be natural. That should be your main goal while you practice. The important reads I would recommend is Good Medical Practice. The Good Medical Practice in Action has interactive online tools that will let you know some ethical consideration you need to go when you're going through some scenarios. Welcome to UK Practice is also another interactive online tool that you can do while you are still in Nepal, and learn about the ethical things that you need to follow when you're working as a doctor in the UK. And there's a GMC blueprint as well, where they will suggest you what topics they want you to cover to be F2 in UK. After PLAB 2, try and relax. I know you'll have a lot of things going on in your head, a lot of flashbacks until you get your results. So try and focus on anything else that will not make you regret whatever you did on the day. Try to give your best on your PLAB 2, and then after you've done your PLAB 2, try to focus on other things, like maybe ECMFG verification, getting NMC good standing certificate if you've not already done that. Once you've passed, you are eligible for full GMC registration. Before you come into the UK, try and get clinical attachment if you can. I know it's getting more and more difficult because of COVID, but if you know some consultants, or if you know someone who's working here, maybe they can try and help you. And try to see what kind of jobs they are offering via NHS website, what they want you to do in the personal specification, and try to do that if you're already back at home waiting for your results and GMC registration. And see what your planning, think about what you want as your future career and what you want to go into in the training, and see what they require at the time for you to be trained on that, and prepare your portfolio accordingly. Just a brief summary about UKMLA. I know most of you who are still thinking about PLAB but haven't started PLAB might be thinking, oh, UKMLA is going to come into the place and it might be as tough as USMLE. So just to make you guys aware, it's going to come into place from early 2024 for IMGs. Right now, PLAB exam is only for the IMGs, and one who have already taken UK medical exams don't need to have any licensing exam like we have here. Back at home in Nepal, like the NMC license exam. So UKMLA is going to be something similar to UK graduate. I think it's more useful for it to be a UKMLA rather than being a PLAB, because you don't know whether they don't know whether they are in similar standard to us or not. I'd say we have more theoretical knowledge most of the times. So it's good to be judged by some standards and to reassure when you come into the practice that, yes, you have the same standard and there's no reason you guys need to undermine me. It's going to be two parts like PLAB. You'll have applied knowledge test like PLAB 1, but it's going to be computer based, and CPSA, which is clinical and professional skill assessment, is going to be similar to the existing PLABs 2 exam. I don't think this is going to necessarily change too much for us as an IMG. It's more of a change to people who are studying in the UK. The English language requirements would be the same. Okay. I think I've spoken too much. If you guys have any questions, you can just pop your questions in the chat, or if you guys remember anything, you can just email me or email Bimal or our generic email of NDA. Thank you for listening.
And thank you, Anushruti, for the lovely presentation. Like during the presentation, I also got my flashback of how I did my PLAB 2 exam and like what were the circumstances. So just a quick question regarding your experience, like how do you feel on like during your PLAB 2 test? How do you feel?
It was a very stressful time, to be honest, because the time I had planned, so I had planned 6 weeks for my preparation, and because there was some problem with my visa, they forgot to include my date of exam of PLAB in the duration of my visa, so I had to get that changed, and it cut off like 2 weeks, almost 3 weeks of my preparation time, so I was really stressed. I think I cried like 2 or 3 times with my friends and with people I was practicing, but I kept on practicing, and I feel very fortunate that I passed PLAB 2, to be honest.
Yeah, obviously the hard working is the key, isn't it? Like you have to push yourself and like practice. So like if you were to give advice to a doctor like who is operating for PLAB 2 recently, so what would be your top 3 advice to give to a doctor?
Be confident, be natural, and listen to your patient and encourage them to talk.
Yeah, true. Yeah. Basically how you present yourself, isn't it? Obviously it's a test scenario, but the main thing is like, just imagine like you are going in a clinic and you are seeing a patient and appear like as how you are, as first of all, greet the patient nicely, talk with the patient, make the patient comfortable, ask questions, and also keep in mind the 3 domains that which is very crucial for you to mark down by the examiner, isn't it?
Yeah, it is. I've been hearing that people have been failing these days because of management. So it's essentially because they have focused too much on their consultation and forgot the time they need to focus on management as well. So involve your patient don't ask questions just for the sake of asking questions. Ask whatever you think is necessary to that history, whatever the patient has given you, and then try and focus on your management.
Thank you. Thank you for your lovely presentation.
Thank you, Deborah.
Yeah, so for that, if you have any questions, so please drop your questions on chat box. And also we do have a useful link that has been shared. And if you need the proper, like if there is any changes in the guideline of GMC, you can obviously check their official website too. So moving forward.
Debbie, sorry to interrupt. I just want to chip in if you allow me.
Yeah,
So I
yeah,
have
sure,
two presentations. One is about PLAB 1, PLAB 2. I've just put something on the chat about the outcome of graduates. So what PLAB is trying to test you is, as Anushruti mentioned earlier, the students, the medical students who have qualified from the UK medical schools don't have to do PLAB. And then it might be useful what it is that the UK medical schools do when they come out of a medical school or graduate at the level of F2. And this is what I have put it here. Outcome of the graduates, and I have put it on the chart. The graduate, when comes out of the program, should have achieved following outcomes. The first one, the readiness per se practice, the ability to manage emergencies and acute health issues, as well as common chronic health and well-being issues. See, so it is quite broad. Emergency is very important. Managing uncertainty, the ability to cope with uncertainty over diagnosis, prognosis, response to therapeutic interventions, medical sciences, and when you call for help. So calling for help, Anushruti mentioned different stations about communications, calling the consultant, etc., etc. Delivering person-centered care, see, listening, hearing, patient's values, so that comes around communication, and then taking account of comorbidities. So the management, as you mentioned, there may be different management options of a disease, but you have to look at the patient in total. What are the comorbidities like? Is the patient fit? What is the frailty? What is the social context? All those issues have to be taken into consideration within the multi-professional team. So you have to, it's not only you, there are so many people around the team in the hospital who is involved in the management of that patient, and multiple care settings and patient's expectations, what they are and what the patient wants. All those things have to be considered. PLAB 1 you mentioned, it is not only the clinical medicine they will test you, but which is relevant to the basic science as well. So anatomy, physiology, pathology, microbiology will come on those questions. It will have the clinical scenario, but the basic science component will be there as well. So I just wanted to touch base onto that. Yeah, thank you. Sorry to interrupt you.
Yeah. Thank you, Mr. Ariel, for giving the lovely advice to the attendee. And moving forward, we do have another presentation on how to secure a job in NHS. It is presented by Dr. Orzo Raj Shrestha, who is working as a senior house officer in University Hospital Dorset NHS Foundation Trust. So over to you, Dr. Orzo Raj Shrestha.
Thanks, Deborah. Hi, everyone. Good morning from the UK and good afternoon to everyone in Nepal and India. I'm just going to share my screen. Hi, so my topic is how to secure a job in the NHS, and it's a very difficult thing to discuss, but I'm Orzo, just to introduce myself. I'm working as a trust grade in stroke medicine and elderly medicine in the in University Hospitals Dorset NHS Foundation Trust. Starting with my presentation, I've put very basic objectives in my presentation. Like I want to tell you what are the opportunities, how to apply in the NHS jobs, and also how to perfect your CV. Well, congratulations to those who have already passed their PLAB 2. I know there are a lot of people in the presentation now, and you are in different stages of your PLAB journey, and some of you might have already done your PLAB 2. So congratulations for that on that. You've done the hard work, and the next step would surely be like getting your GMC registration done, which would take about like a week or two. And it's very straightforward. And after that, after you do a GMC registration, as Anushruti told Raina, like in previous presentation, you should look for the jobs in the NHS jobs. But it can be a difficult task, I know, and most of us, most of my friends, they have been applying in the NHS jobs for a few months or so, and without any luck, without getting any interviews. Even if they've got interviews, they might not have, cracked it, but it can be difficult. But we are here to kind of help you with what we can do in terms of like to better our chances of getting into the NHS. Starting with the opportunities in the UK itself, I think there are two basically things, the NHS and the NHS and the NES, but I would like you to focus in the NHS because that should always be your goal. And I would like to talk about why NHS should be your priority and what are the non-training grades that is most feasible to apply for, because as IMGs, and we don't know what are the different gradings that are in the UK, because in our part of the world, we just call it medical officer or medical doctor. But in the UK, there are different names given to a different grades, which you can apply for, which most of us do not know before coming to the UK. So I would like to help you with that. And also, I'd like to discuss about the site which you can use to apply for jobs in the NHS. So starting with why NHS should be your priority, starting with training pathway and career progression, because I think as after doing our medical degree, our goal would be getting to master's training, and NHS gives you that pathway. So you have to be in the NHS to progress in your career, go into the training pathway. And NHS really supports you very well. You are given shadowing period, because as an IMG, when you come to the work in the UK, because NHS has a very difficult and a different system, which is very complex and it's very difficult to understand. The clinical bits are similar to what we do back home, but the system is very difficult. And NHS gives you that kind of period where you just settle in, and they help you in terms of to get to know what the system is all about. And also it gives you study leaves and study budgets. So if you're preparing for exams for further career progression and everything, and if you have spent money there, then you have a certain amount of money that can be reimbursed back to you because you use that money for your career progression, which is very good part about the NHS. And you are really entitled to NHS pension as well, which is a good thing. You can opt out of it, but if you're thinking of settling in the UK on long-term basis, then NHS pension is a good option for you. And because of this COVID pandemic and everything, people have really appreciated how the health professionals have worked for them and everything. So I think there are different brands and shopping complexes have come under something called Blue Light Card, which you can use as an NHS employee to get discounts in various shopping centers, brands as well. And you are entitled to annual leaves as well, which keeps on increasing. The number of days increases as you progress in terms of your how many years you have worked in the NHS. So I think these are really important points and good points just to make sure that NHS is your first priority. What are the different non-training grades posts that you can apply for? I think this one is very important because, as I told you, we don't know what are the names that are given to the junior doctors in the UK. And when you apply for jobs using the NHS jobs, which I will discuss in a minute, we don't know what to apply or what do we type in the keywords and everything. So basically, when you are starting in the UK, I'm a trust grade and I'm working as a trust grade. So there's something called trust grade, junior clinical fellow, senior house officer, or FY2. These all name means the same. You will be doing the same thing in the hospital, but it's just the different name, but you're in the same post. So just to make sure that when you're applying the NHS jobs to work in the NHS, you can search for vacancies, typing all these keywords, which will be really helpful, and there'll be lists of jobs available. And now moving on to how you can apply and where you need to apply for. So the most important website and the most widely used website in the UK is www.jobs.nhs.uk. What you have to do basically is create a profile. You have to search for jobs, which I said using the keywords just in the previous slide. And then you have to work on your CV. This is the most important thing. And this is the website that I have taken a screenshot from. This is the front page. I have logged in as myself, and here in the keywords or job reference, you can put down like trust grade or senior house officer or FY2, and you can be specific about your location as well. Some people might be like like more inclined towards working in Manchester only, so you can put your location as Manchester, and then you can search for jobs that are available in Manchester, and that's really, this website is very useful for that. And first you'll have to create a profile. This is how you have to do it. You have to put in your personal information, your address and everything. You'll have to put in your qualifications, your employment histories back in your home, what you've done, and some references. I think minimum of 3 references that'll be required, and some supporting information. Supporting information is really important when you are doing making your profile, because whenever you are applying for a job in different hospitals, you'll have to look into specific job specifications and person specifications, which all the hospitals have included in their vacancies, just to make sure that you need to know what the job is specifically requiring and asking for. So you need to highlight that points. So, and that will increase your chances of getting that job, because people will want to see that I'm looking for this. Does the person who has applied have these qualifications? So they'll be looking in that. So supporting information is a very important part in that. Now, the process that goes into getting a job. You apply for job, as I just show you the profile. After you complete the profile and you search in the keywords and everything, you see the vacancies, you apply for it. Then you are sent an email by the medical staffing team or the HR that saying that you are selected for the interview, and then you give the interview, and then if you are selected, then you get a response from the medical staffing team saying that you are selected. Then you get your certificate of sponsorship, and then you start applying for your visa. Now, I think this is one of the most important slides of my presentation, CV boosting tips. These are some of the tips that I think really helped me get the job in the UK and might help you guys as well. So starting with Bls and Als course. So I think this is a a very important thing for medical students. UK has something called Resuscitation Council UK, which and the UK does not recognize American Heart Association ALS and BLS, but nevertheless, I don't think we have Resuscitation Council UK's accredited ALS courses in Nepal, but you can do AHA accredited courses in Nepal, which can help you in getting the job. And you can attend conferences, seminars, and webinars as well. These, I think, because of COVID pandemic, most of them are webinars now. But if you get a chance into getting into one and get evidence for that, then that's really helpful. Get some paid or free CPD gaining trainings, like a single-day surgical, simple trainings or things. You can do quality improvement projects or audits. I think this is a very tricky part for someone who are in Nepal, and because we don't have this kind of system that is present in the UK. So, but nevertheless, what you can try to do is, like, let's say, for example, you are working in an emergency department and you think that the emergency department form that you have in your hospital can be, better, and you have some ideas regarding that. You take your ideas to the hospital management, and if they think that that would better the emergency department form, and then you work on it, you change it, and you gain an evidence for it. I think that's a quality improvement project, and you can add it in your CV. And I think that's a very simple thing that you can do, and you can really boost your CV with that. Publications and research works, without any doubt, if you have done it, you will surely put it. But if you have not done it, if you have time, then you can work on it. Simple things like case reports can be like a boosting tip for you in your CV. Teaching and leadership, and as I said, evidence required. So, as medical doctors, I think all of us have taught when we're internship. We've taught our final medical students, third year medical students, even the nursing staffs, as a bedside teaching, or in our wards as well. You can use that as an evidence, and you can get some feedbacks from the students or the staffs that you have taught, and you can use that in your CV. And because of the COVID pandemic, most of us have like a very big gap between our PLAB 1 or PLAB 2. And in that gap, if you have already thought of like doing like medicine in the future or surgery in the future, then you can at least try MRCP or MRCS exams. And if you show that you are committed to this kind of specialties, they will surely hugely boost your CV. And I think this was mentioned in Anushruti's previous presentation. After you've done your PLAB 2, you can attend something called Welcome to the UK Practice, which is organized by GMC. You can look in your GMC account. I think there's they have the information for that, or you can send an email to the GMC asking for when they will be doing this Welcome to the UK Practice, and apply and attend this. This will really help you in getting an overview of how the system works in the UK, the ethical bits. There's something called Good Medical Practice in the GMC website, which you can access to freely, and that really that can help you in terms of like the ethical situations, which is really tricky in the UK, which can have some medical legal issues. So just get an overview of that before you come into the UK. I think you will be asked about these things, and you can be asked about these things in the interviews as well. So which is a good thing to get a beforehand idea of this. Preparing for the interview. This is one of the most important parts in the NHS, getting jobs in the NHS. Here are some of my tips. Be very familiar with the job description and person specifications. I think I discussed this previous slide as well. There's always a few hyperlink for like, what are the job descriptions and what are the person specifications, meaning what the hospital or the foundation trust is exactly wanting or requiring that person to have, so that they can get the person, person in the job. So if you look into that and work accordingly in your supporting information in your profile, then that would really help you. And always remember what you wrote in the application, because you will be asked, and you might be asked, not you will be asked, you might be asked about particular like statement that you have written in the application, and you need to remember what you wrote, and you need to explain why you wrote it, or explain the scenario, or the story behind what you wrote it. So you need to remember that. And when you and this is really straightforward, when you get the question, first think and answer the question. Just don't haphazardly just start answering the question right after you hear the question. Just think, give yourself time, take a breath, and then you answer the question. And most importantly, prepare for some clinical, ethical, technical questions. Clinical and ethical questions are a very like straightforward. You've done your PLAB 2s, and it's similar to those. You can also see like good medical practice that I just talked to you about. You'll be like given a scenario like there's an 80-year-old gentleman in your ward who's just been admitted. He's getting agitated. He doesn't want anyone to give any medication. He wants to leave. What would you do in that case? So these are kind of ethical scenarios that you will be asked. So you just need to know what's the approach that you need to take in these situations. And for these, I think your PLAB 2 examining preparation can help you. And also, as I said, good medical practice, that booklet is really important. That can help you with that. And there's something called clinical governance audits or QIPs. You'll be asked about these things because in the UK, they really care about, getting things better every single time, because they know that there is always some flaws in the system, and they want people to look they want people to like see what can be done to make the system better. So they really like clinical governance audits and quality improvement projects. So you might be asked about what idea do you have about these things. So you can just look into the Google and just get an overview of these things. And most important thing is like your body language, positivity, respectful and empathetic. You have to be respectful. You have to be cheerful. You need to be like, you need to show your persona like that you are approachable, you are kind of thing, so that because people really care about these things here. Now moving on to the next part, there's something called FY2 standalone posts. So I just want to give you a brief idea about this, because this is a different route from NHS jobs. because NHS jobs is a non-training post, which suppose like I'm doing my training, my rotation in elderly medicine. I'm in elderly medicine for a year. I don't have any rotations, but there's something called FY to standalone post, which is a very structured program like foundation year programs. But it is only, this is suitable for those who have done the internship, like the IMGs in our country. They can apply for this. So the registration is opening. The registration is opening from the 4th of January till the 1st of February. So who can apply for this is those who are going to do their PLABs in the next few months, and they know that they will get their GMC registration by August, by which from which the foundation program will start. So this is a 1-year program, which is a very structured program. You will have your rotations, you'll have access to e-portfolios, your e-portfolios, so that you can work on that and work on your CV, so that you can get further progression in your career in terms of masters and everything. Now, this is something called NES Healthcare. Some of my friends who have not been able to get into the NHS because maybe a different things, or they want to have a different experience, then there's something called NES Healthcare, which is a kind of a private organization, but it works closely with the NHS. But I would not suggest go with the NES first. NHS should always be your priority. But in case you might find it a bit difficult to get into the NHS, or it is getting up, you're waiting for a long time, you want to get in the UK as soon as possible, then this is another option that you can choose, where you will be working as a house officer. And I think this is a bit more easier to get into. But as I said, the difference is that you won't have the career progression, you won't have other benefits that the NHS has, like supporting the new IMGs and everything. So NHS should always be your priority. But just to give you an idea, there's something else as well. And let's say you are in the UK and you have done your PLAB 2, you're waiting for your results, and you still want to stay in the UK and see like for another month or so, then you can do something called clinical attachments. I think most of you have heard of it. For clinical attachments, you can apply for an established clinical attachment programs. You can search in the Google where are the established clinical attachment programs. You'll surely have some lists. You can apply for it. Or because of the COVID pandemic and everything, it has been difficult for people to get into finding clinical attachment. But you can contact hospitals or consultants if you know any. Like how you can search for hospitals is like you can go into a specific area, search what are the NHS hospitals in that area, get the details of the hospital, contact details, and just email them saying that I would like to do a clinical attachment in your hospital. If you have, let me know if you have any vacancies for that. And you can also check with your friends if you have any in the UK who are working in the NHS, and they might be able to help you as well. So clinical attachment basically is like observership or externship. UK, you will be like attending the ward rounds with the consultants, with the junior doctors. You are able to like talk to the patients. You can examine as well, but you're not allowed to prescribe or do discharges and everything. You are not allowed to give your kind of you are allowed to give your opinion, but you are not allowed to change the medical side of things, medical management side of things. But it is a good exposure in terms of like you get to know how the NHS works, what the system is. I think having your clinical attachment in your CV will help you in terms of like, well, this guy knows how the NHS works. And if there are like two people waiting for one job, if you have a clinical attachment and the other person does not have it, then there might be a little bit of increased chance of the person who has clinical attachment get the job. So you can try and find it if you have any. But having said that, even if you don't do clinical attachment, you will get the job in the NHS. And there's something called medical social worker, which is a kind of a new term where it's in its preliminary phase, it's in a trial phase. It is another opportunity for IMGs to get in touch with the NHS. It is similar to clinical attachment, but also something called physician's associate or doctor's associate, which is like you will be working with the team, with the consultants, with the nurses, with the junior doctors, you will be attending ward rounds, but you won't be able to, like, as I said, I've written in this slide, you won't be allowed to prescribe drugs or do discharges, but you will be paid. You will be paid in this. I don't think you'll be paid in clinical attachment though, but some trusts do pay them. But as a medical social worker, you will be paid, and you can. These are the options that you can choose before, like if there's a gap between you getting the job and you doing a PLAB 2 exams and everything. These are some of the references that I used while I was like preparing for my journey, PLAB journey since the beginning. It has been a long journey, but I mean, I'm sure you guys are working hard as well, and you guys will surely get there. But these are some of the references which you can use, like in terms of getting help about what are the things that we need to do in this situation and everything. And that's about it. That's from me. And you can, this is our generic email. You can email us, and if you have any questions, and if there's anything we can help you with, we will, like, as an NDA-UK team, we would like to help you with your journey and see you get here and work with us. Thank you.
Thank you, Orzo, for the excellent presentation and like giving some of the insight regarding how to secure a job in NHS. And I also want to make a quick correction on the slides that it's a medical support worker. It's not a medical social worker. Yeah. And and also, would you please like to share some of the experience when you were in the phase of like applying for the job? Like what did you do for those candidates who is like already get their GMC registration and now in the process of getting a job?
Yeah, so thank you for your question. So I think I did my PLAB 2 in September 2020. I got my results in the same month. Fortunately, I passed, and then I applied for GMC registration a month later. I did my GMC registration. I got my GMC registration in November 2020. Then I started applying from December. For the first month was really difficult because I was applying like 20 to 30 trusts like every single day. Mm-hmm. First week I didn't hear anything, and from the second week I started to get emails, but all emails were like, sorry, we cannot accept you for interviews this time. So like I had like 50 to 60 rejections in the first instance, but finally I talked with a couple of my friends who had already got their job in the UK and who were already working, and I looked into the references that I just showed in my slides. Then I started working in my profile in the NHS jobs itself. I started to like be very specific about supporting information in different for different trust vacancies. I didn't just send it to all the trusts the same supporting information, because as I said, the job specifications and specific person specifications are very different in different trusts. So you need to look into that. I looked into that, and I worked on that for every vacancies that I applied for. And then I got my first interview in, I think that was in the middle of January. And then I attended the interview in the end of January, and the next day they said that I got the job. So this was my experience. So, but also having said that, I had to work on my CV. Like I had not done the formal, I had the BLS course done, but ALS course, I had not done it. So I did the ALS course, which was AHA accredited. But they were like happy in terms of like I did the ALS course, and I had done some like attended webinars. I attended the GMC Welcome to the UK practice seminar as well, and also read the good medical practice things, which helped me in answering the ethical questions that I was asked in the interview.
All right, thank you. And also CV is very crucial. Like we need to update regularly, isn't it? Like
exactly, yes.
Yeah,
yes.
We can do a CPD points learning on VMJ or like accredited courses also, isn't it? Yeah.
Exactly, yes.
And also, there is one question. They were asking if clinical attachment make a difference in getting a job. Like, do you have any idea on that?
It's a very difficult question to answer. As I said, if like there are two persons who are fighting for the same job, if you have a clinical attachment, you will have a certain kind of advantage because you will know what the NHS is all about. how the system works in the NHS, the complexity of the system. So you will have that advantage if you have a clinical attachment, but it's about improving your CV and getting the interviews really well. If you've done your interviews really well, then you can overcome the person who has done the clinical attachment. So I would not focus a clinical attachment like it's a very important thing, but it is a kind of helping hand in getting the job. It's not a very important thing. I think you're improving your CVs and doing your interviews very well is very important.
Yeah, true, because focusing on the CV is very important, and getting a clinical attachment is not the all thing. We
Sorry,
do have one hand raised by Ashish Shrestha. Yeah.
Hello, it's a really nice presentation, really good one.
Thank you, sir.
Did we talk about RMOs? There's also option of doing job as RMOs.
I did. I just
okay, good.
I
Now,
briefly touched on it.
The most of the people that comes to my hospital, they do clinical attachment when they come from Nepal. Now, I think it's a bit of a luck also, and I have given job to most of them. Half of them will get the job, but at least that clinical attachment will prepare them for a future application of the jobs. Now, they'll have a reference. That means we can be a referee. That's very important. Local referee is very regarded as very important in when you're applying for any job. But yes, I think the clinical attachment in a way prepares them for the proper job.
Exactly. As you said, it is very important. I mean, like, if you have a chance to apply, get into clinical attachment before getting a job, go for it. I would not say like, don't get the clinical attachment. But if you are saying that if you are waiting for clinical attachment to do clinical attachment, then only I'll apply for jobs, I would say no to that. Go and apply for jobs, and side by side you can apply for clinical attachment as well.
And I told them, I'm like, I think you need to do everything. I'm like, you need to hit like it's like a shotgun. No, you hit everything and you'll get something out of it.
Of course, yes.
And the amount of like you have done application that way, I think that the main thing is not to get frustrated at all. Keep on trying and see where you have gone wrong.
Exactly.
And improve your CV. I'm like, every time even somebody like at home, they can do audits, they can start the publication, case reports. That will help them a lot. Keep a logbook of their cases that they have done, and you can use the FRCS, EFRs, the Royal College of Edinburgh logbook system. You can use those. There's a lot of ways. I'm like, you can help yourself in a way.
Yes, exactly, sir.
Thank you, Orzo, for the presentation, and also Mr. Ashish Shrestha for giving some of the advices. So moving forward, we do have another presentation, the last presentation for today's webinar. It is on the building of portfolio in NHS role and application process for a trainee post for general surgery and internal medicine. And the presenter would be Dr. Bista, who is a general surgery trainee in the UK and Health Education England, Yorkshire, Humber and Honor Tutor, University of Leeds. He has a special interest on HPB and transplant surgery, and he is able to secure 80% on his portfolio station after having 8 months of experience in NHS. So I'm also looking forward for this presentation. So over to you, Dr. Bista.
Thanks, Deb. Just let me share my screen. Just a second. Just a technical glitch in here. Yeah. Hello, everyone. Namaste. I'm Bishop, and I'm currently working as ST1 General Surgery trainee in Yorkshire and Humber Deanery, and I'm also working as Associate Surgical Skills Fellow and Honorary Tutor in University of Leeds. So in today's presentation, I'll be basically talking about how to build your portfolio and while you work as an SHO, but most importantly, how you can prepare beforehand you come to UK. So I'll be taking you through my journey, how I prepared my portfolio, and I was able to secure a training job here in UK. So this is the overview of a training pathway. So this is a general surgery one, and this is for the medicine bit. So here, when an international medical graduate comes to UK, so there's usually something called 2 years of foundation training, where it's foundation year one is more like an internship that you do back home, and a year two is equivalent to the SHO years that you do. So if you opt for a co-training, surgical co-training, then it's 2 years of surgical co-training followed by 6 years of specialized training. After that, you'll be able to complete your training or CCT, and then you can apply for the consultant job. While in case of medicine, it's similar to the in terms of the foundation training. And after that, there's a 3 years of co-training and 5 years of UK dual training, or depending on which specialty you want to go. So this is a general overview of the training pathway. And also there is something called Certificate of Readiness to enter into the specialty training. This is the most important thing before you can apply for the application process, because without this form, you won't be eligible to apply for any of the training posts. However, there's a technical thing in it. You can also get this form signed while you're working in Nepal, and this form will test your technical abilities, and depending on the generic professional domains set up by the GMC. So it will look at your professional behavior, professional organization, and other bits like how you present while communicating with the patients and those sort of things. The main reason for me to give you an overview, even before coming to the UK, is you have to be mindful about what you want to achieve once you are in the SHO post. Rather than knowing all these things after you start a job, after 5 or 6 months down the line, you have to have this mindset before coming to the UK. So this is the reality, or the competition ratio, I call it. So be mindful of the competition ratio of your future specialty, work hard, smart towards it, and achieve it. Just to give you an overview of it, when I applied for my co-surgical training, so there were around 2,500 applicants, and there were only 607 posts available, which was a 4.16 in the ratio. And among that, the post I got in run through, there were only 43 posts. So you have to be mindful of which specialty you are willing to go in, look at this competition rate, pull up your socks, and start working on it. And this is just a brief idea on the timelines. So usually the adverts for the job and things opens up during the month of December, first week of December, and then there's something called opening up the evidence portal, which will open in the mid of December, and interview usually happens around January time. So just an overview on the training application process, how everything works up in the NHS. So when you are applying for the ST1 role, we call it Specialist Training Year 1, or the co-training year 1. So it involves 3 processes here. So usually there's something called shortlisting, interview, ranking, and offers, which I will be describing more in a varied way later in my slides. So just to give you an idea, the first stage involves the self-assessment portfolio score. What is portfolio score? Portfolio is usually based on what you have done so far during your post, involving your teaching skills, your surgical courses, or the medical courses that you've done. So they have designed this system to give you points. For example, there are 72 total points in a portfolio scoring system. To give you a brief idea, for the surgical portfolio, MRCS Part A exam, if you have sat and passed the MRCS Part A exam, you will get score of 4 points. However, if you have sat that MRCS Part A examination and failed, you wouldn't get any points. And just bear in mind, this portfolio point changes every year. So during my time, even sitting on the exam would give you 1 point. And other bits are attendance at surgical courses. So if you have attended 4 or more surgical courses, then you can get 4 points. And if you have attended 2 or 3 surgical courses, then you would get only 2 points. So the reason for me to explain these things is because there are certain courses which you can apply or which you can attend while you are in Nepal or in any part of the UK before applying for the training post. So that'll be a plus point for you. Also, there's something called operative experience. So involvement in 30 to 39 cases will give you 6 points, while just the 20 to 29 cases will give you 4 points. So there's something to be mindful of. We've all worked in various surgical departments. We've assisted in the training. What we don't have is the evidence. So creating that evidence is the most important thing. You should start from day 1 of your UK journey. And also there's surgical conferences and surgical experience. These are the things. So the portfolio points, these points will make up 33% of the overall score. And it is the only aspects which provides guaranteed points. So before even walking into the interview, you can have those points in your pocket and walk confident in the interview. And the remaining points are usually the management and the clinical stations, which you can score during that interview session. So these are just the portfolio. So during my application, the total portfolio points was 72 and the cutoff for the shortlisting was 47. So after you have the self-assessment score, if you have points above 47, then only they would ask you or shortlist you for the interview. So that's how important is the portfolio points. And I think every single person who wishes to come to UK and wants to join the NHS should have this idea before landing in the country. So these are the self-assessment scoring criteria for the core surgical training and the internal medicine. So these are the sections that they have divided, which will give you points. So first one is the commitment to specialty, postgraduate degrees, prizes, quality improvement project, teaching experience, presentation, publications, and leadership and management. So all your points, 72 points, are divided in between these headings. And so you can score accordingly. In the medicine, internal medicine training self-assessment, it's also again divided into these bits. So I'll be taking an example of core surgical applications, which will also apply for any other training programs that you will be applying for. So commitment to specialty is the important one that I mentioned earlier regarding the MRCS exam, regarding the surgical courses. So what I want you guys to focus on is there are a couple of courses, please note down these courses, which you can do while you're in Nepal. So especially urology, national catheter education program, and essay preparing for a career in surgery. So these are the free courses which you can do while you're in Nepal and get the points for. Because if you do these 2 courses, you'd still score 2 points here. So you have something under your belt even before coming here. And for the logbook, there's something called e-logbook, which is free of cost, which you can get access even in Nepal and start logging the details. So this is the important one. And these are some courses which I did and got the points for. So my only advice regarding these courses would be always try for the courses organized by medical school. For example, I'm at Prozoldi in King's College London neurosurgical conferences. And these are the colleges like King's, Oxford, Cambridge. If I'm telling this for those who are here, they organize these conferences, which is very cheap, and you can present your posters or anything there and get the points for it. So always aim for these conferences rather than the big one, which is expensive and you have to travel. And also the conferences in Nepal count as well. So be mindful of conferences going around arranged by a local doctors association, which can be helpful. So the other bit that's very important here is the surgical elective and surgical taster. So this is quite a new term they introduced during our portfolio scoring system. I think every Nepalese person coming here should be mindful because there's nothing called surgical elective in Nepal or in our medical school. So just to give you a brief idea about what surgical elective is a period spent away from a medical school, often abroad, and depending on the time where you do it, it can be 4 to 12 weeks. So for a catch, what you can do if you're in Nepal is you can actually do this surgical elective in between your final professional exams or final exam of your medical school before starting your internship. But those who are already working as an SHO or house officer, don't get disheartened, because you can always opt for an elective even during your, if for example, if you're doing a job in medicine, you can do an elective in the surgical bit in different hospital in the peripheries and get an idea of it. This is very important because it will score you 4 points, which is equivalent to a PhD. So if you work on it, you can get points on it. So a minimum of 4 weeks is important. So make sure you do this while you are in Nepal rather than coming here, because it'll be difficult for you to get an elective here for 4 to 6 weeks. So yeah. And I did my elective at UCL where in neurosurgery. And so creating the evidence is another important thing. At my time of application, they wanted me to write in reflection. So I wrote a reflection on it. So, but this time, I don't think they've asked for the any reflections, but you have to be mindful where you can get this. And another thing is surgical taster. So these surgical tasters, for example, if this is designed for the UK Foundation School, so some doctors might not have a rotation in surgery, but they might still want to do surgery in the future. So what they do is they will get 5 days of gap from their usual rotation in medicine and go to the surgical department and do a taster session of it. They take part in the rounds, assist in the operating theater, and they go from there and they decide whether, not exactly decide, but they get a taste of how things are and move forward on it. So make sure if you're in Nepal, do the surgical elective, get the evidences. If you're confused about what to write in the evidences, then we can always, as an NDA-UK, we're always there. We can help you forward onto it. So another thing is postgraduate degrees and qualifications and additional degree. To be honest, I scored 0 in this one. I didn't have anything. So like I said before, a PhD will score you 4 points, bachelor's degree other than your usual one would score you 3 points. Research master's degree will score you 3 points, and likewise. So what I thought was, rather than going for a master's and getting a 4 points, I would rather do a taster or focus on my audit or another thing, which would score me equal points. Plus, these courses are expensive. If you can get bursaries, then you can always go for it. But if you don't, then I don't think you can go forward. So here's another thing, prizes and awards. This will give you points as well. So awarded a prize from a recognized surgical institution or national conferences will give you 6 points, while also one prize awarded at local institution will give you 1 point. So there's a catch on it. Again, during our med school, we've sat numerous exams, numerous card finals, ward finals, and subject finals. So if you are placed or if you have ranked in any of those, get a certificate from your dean or get a certificate from the consultant or departmental head, and you can still score 1 point. It doesn't have to be a national prizes or a big prizes. Any simpler prizes you get can be used to score these points. So start collecting your evidence from now, from your med school or in Nepal or here, and then work towards it. So yeah. I think this is the most important slide among all these, and probably this is the only definition I memorized during my interview preparation thing. So what is audit? So audit is simply, if there's something going in the department or in the health practice, it's reviewing of that current health practice against the agreed standards. So you are reviewing things, what's been happening in the department or in the hospital with the set guidelines. So we have set guidelines from the Royal College or from the Royal College of Physician or GMC, and then we try to compare these. So these are the basic cycles in it: identifying the problem, defining criteria, data collections, comparing, implementing. The reason for explaining it a little bit more is because it will score you 8 points. Bear in mind, a PhD will only score you 4 points, but doing an audit will score you 8 points. So, and another important catch on this one is you have to lead in all aspects of this surgical themed or medicine themed projects in it. So you can do this audit while you are in Nepal. So you can participate in your hospital, work with your consultant, check if the VT prophylaxis has been prescribed well or not, and do an audit on it. After finishing one cycle, do some teaching about it to the fellow colleagues or the nursing staff who does the VT. Again, do the second cycle, and then yeah, you can present in the local teaching or the other conferences and get the points for it. But the most important thing is leading in all aspects of the audit. So after this one, yeah, and you can always chip in to the QI projects or the quality improvement projects in the department. If you're in UK, then always ask your seniors, your registrars, your consultant about these projects. So these are the audits that I was able to do. So I would suggest this one as an easier one for you. That's why I put it in here. So while consenting, so if you're in the surgical department, you can always do an audit on how consenting works. It's an easier one. You can develop something and you can present. And also if you're in the medicine, then you can always use this one as well, use of antibiotics in the medicine wards or anything, and you can do an audit on it. And also creating evidence and presenting it is another important thing. So another aspect is the teaching experience. So this year, they have emphasized more on the teaching experience rather than anything. So, sorry, 10 points in this teaching experiences. While in my time, when I applied for it, it was around maximum 6 points or 7 points for it. So these are the things that we often do during our med school. I remember teaching first year medical students when I was third year, the anatomy and the bones and everything, but I didn't have any evidence of those bits. So have some evidence of it, how you can make the provide the evidence that you have run the teaching session. So for every teaching session that you've done, get a feedback form, because that's the most important thing which you can use as an evidence. So so if you're here in UK, gather around, have a couple of good friends around, sit down and plan for a teaching session. So when I first came in here, so I was working as an F2 in Leicester, so there was no departmental teaching there because of the COVID, everything was stopped. So I spoke with a consultant and said, look, this is a thing that's not happening here. I would like to start teaching with my colleagues and get everyone involved. And he was quite happy that I took an initiative. So don't hesitate to take initiative, because at the end you need to lead a project to get the maximum points. So don't hesitate on that one. And I think as an international medical graduate, what we don't do is set out our terms to the consultant. So don't hesitate to see, I'm here for this period. I want you to help me to do this. And these are my goals and I need to achieve it. So how can you help me to achieve this in a polite manner? So you can always say that, and they are very helpful about how you can do things and get you involved. If you show your interest, they will for sure get you involved in this one. So these are the teaching experiences which I had. I set up a surgical teaching series in Leicester. These are the feedback forms, and again, creating evidence. Make sure you have evidence for every single bit that you've done. So I did, so GSTS is the one that we started in Leicester and now in Hull, and we've started this one. So it's more like a national project for me now. And also, if any one of you in any trust would like to get involved in the project, do let me know. We can arrange. We have everything set up, and you can start GSTS in your center, and it will be counted as a national teaching series as well. So training in teaching. So this one is the expensive bit. So in my time of application, they said like 5 days of, at least 5 days would score you maximum, but this time they have changed. So these are the courses that I did during my applications. So Royal College one, training the trainers, advanced teachers, training in teaching. So for those who are in Nepal, you can do this one. This is free open university learning to teach, mentoring and tutoring student teachers. So this is a free one, note down, and then you can do this. other than that, Oxford Medical, I'm not advocating for this one. These are the bits that I did. So I'm just saying they do online ones. So if you're in Nepal, try to do 1 or 2 courses. It will cost you around £150 to 200. I mean, if you are up for it, then go for it, and it'll be helpful. Also, in your university hospital or your hospital after you join here, they might provide some free teaching courses, so should be helpful. And there's something called PG Cert, yeah, Postgraduate Certificate. So the catch on it is expensive, and if you can do it, it's okay, it's good. It will cost you around 3,500, which is helpful during your ST3 or specialty training applications. But yeah, you can do it now or do it later. So these are the presentation, oral or poster presentation, which you can present, and always be mindful to present this in the medical school student societies, conferences, and other societies one, rather than going for the big one, which they won't. It'll be very difficult to accept for your level. For as an FY2, there are foundation conferences which you can present these. ACIT, Medal is the one which pretty much accept things from the foundation years. Also, if you're in Nepal, if you have something, then send this to these organizations. They have a separate section for the international ones, protected, and you'll be able to present your audit or any other bits in here. So this should be nice. And publication is something for me, it was kind of challenging one, because I didn't have any prior ideas about it. So I always made sure my registrars and my consultants are aware of my interests and said, look, these are the things that I want to do. Will you be able to help me? So they said, like, for the initial bit, I started with the data collections and then went forward for writing a bit, and then got involved into more. So if you're here, then do get involved with the registrar consultant and tell them your interest, and they should be able to help you. If you're in Nepal, do collaborate with your consultants and your medical school. They should be able to help you, and make sure it's all PubMed ID'd in this one. The leadership role is quite important here. If you could see, there's like 8 points for the leadership role. So we are involved in certain activities during our medical school, might be a student society, might be mess or anything else, but make sure you have evidence for it. Always offer what more opportunities you can get. For me, the biggest opportunities now I had is with Nepalese Doctors Association UK, where I'm in the exec committee. So always offer it. You can always join our organizations and also get involved how you can enhance the teaching or other bits, and also equally you can get the leadership role and points on it. So always look out for these things. And at the end this year, I think all the run-throughs training, that's 8-year straight training, has been paused by Health Education England for the England. But however, there is the application process for the run-throughs going around in the Wales and Scotland. So another important thing I would say and advise is get involved. If you are here, if you're in Nepal, NDA-UK for your future progression, don't forget that one, because we will be running lots of webinars, lots of skill workshop and things. So we will try our best to help you in every way possible. But to grow our support community, we need more members so that we can see what are the needs of our members and draft our work accordingly. So I think this is the most important one. And before this one, I would also like to say something about being overqualified. So if you are working in a surgical specialty, and if you plan on coming here in UK, so make sure you have worked less than 18 months in general surgical post if you want to apply for the core surgical training or the ST1 specialist training 1-year surgical training. Because if you work more than 18 months, then you will be overqualified to apply for this. But again, there's a catch on it. So in their criteria, they've said excluding the foundation years. So if you have worked these during your internship or during your SHO, and if you could ask a consultant, they could write a letter stating your role was equivalent to the FY2, then you might get excluded from that 18 months thing. But again, be aware of that one. And if you want to apply for surgery and you've never done it before, and you are very unknown to every single fact about UK and NHS, how it works, make sure you come and join for the medicine department for a bit and then get an idea about it, just to make sure that you don't overqualify. What I've found most of the people do is, yeah, they're very interested in surgery. Now they will come straight to the surgical departments. And by the time they know about the applications and everything, they're already overqualified. So you have to be very mindful of that thing. And also, just if you could complete the mandatory feedback after scanning the code, and also for the certificates, these are the 2 codes you'll have to scan. And please feel free to drop a line of queries regarding your application process or anything at all. And also we have our PLAB inquiries at nda-uk.org email address. You can send us an email on there. We will try our best to reach to you as soon as possible. So I'll just give you a brief time to scanning these things. And also, I've only used a surgical portfolio as an example, but for the medicine, if you do these bits, it's almost similar. You can score a good points on your portfolio and you'll be able to do things. So during your SHO years, these are the things you should be working towards from day one, rather than knowing about these in the later years. So that'll be all. And I am happy to take questions.
Thank you, Bista, for the descriptive presentation on how to build a portfolio for the future trainee post. And also, as you have said that we should be very mindful about the criteria for the application, as you have said that by the time that we figure it out, like what are the points, then we just figure it out in the surgery that we are just overqualified, which means that that would be the demerits for the international medical graduates. Yeah, and also I also like to point something like for the career, it's a very progressive process, and like you have to work very hard. You have to build a portfolio, you have to get into the leadership, teaching, get the courses done, and all those things that NDA-UK will be also be doing in the future. Reference on the conference will be also be done. So if you are looking forward, then you guys are always welcome in our organization. Yeah, looking forward to you guys. And also we are at the end of the session. So Mr. Arya would like to give some of the closing statement. Yeah, over to you, Mr. Arya.
Assis, is that old hand or is that new hand?
That's a new hand back.
Yeah, please.
I think Bista did a very good presentation. I think it's difficult when somebody comes to UK to build up that portfolio that Bista has built up. And I think he should be commended for his work. As he said, you should start from now rather than later if you're planning to come to UK or applying for any training post. What I found is that is somebody who is on a trust grade post, it's very difficult for them to build up this portfolio unless they are self-motivated and be focused and have a folder. Nowadays, electronic folder, I'm like, you can make an electronic folder and have a hard copy. And if you're coming from Nepal, try to have that evidence in hand before you come to UK. It's really important because you don't want to go back and ask them again for the, all the hard evidence and so on. It's very difficult. So do it from now.
Yeah, thank you.
So thank you for all this, especially the speaker. So we had the morning, nearly 2 hours is gone. So I'm very grateful to our senior immediate past president, who is Ramesh Koju is here, I think, Dr. Ramesh Koju. And Dr. Paras Singh is here as well, who is our executive committee general secretary. Dr. Ramesh, is there anything you want to say?
Yeah, thank you very much, all presenters. Excellent presentations. So I think we must be very proud of NDA. So we are in good hands with our juniors. And I mean, I can remember from last year, Deborah, Anu, Arzo had same problem as now. So I think we helped them quite a lot. Hopefully, India will be continuing helping our juniors in their career pathway. Thank you, Dr. Prabhu.
So before I start mine, what I want to do is, if it is okay with everybody, I want to take the screenshot. And for that, if you turn the camera on, please, yeah, just to take the screenshot, turn the camera on so that if you are happy with that, obviously, so that we can at least see each other. Wonderful. So I'll just take the screenshot of this one, which is, that is done. I just goes to the second page. Second page, most of them are no, camera is not on, but doesn't matter. I'll just take the screenshot. So the journey looks quite long if we listen to it here, and if we think about it, and trying to cover that in 2 hours is quite a difficult task, I think. But despite that, I think our presenters have done a tremendous job. A lot of preparation is gone on today, and I'm very grateful to everybody. So we started with PLAB 1, what it involves in brief within half an hour. Then we went to PLAB 2, and I hope we will have been able to give a brief overview. It's impossible to give the long overview, but then we have got that email. If you have got any queries, please do not hesitate to write to that email, and we'll do whatever we can to try to help you. There was a question about trying to make a center in Nepal, and we'll correspond with the PLAB examination and the GMC here, and what are the options. We have tried to do that for Edinburgh College surgical exam, and one of the things they said was they didn't have enough candidates to try to make a regular center. But looking into the chart, looks like there is enough demand with a lot of medical schools in Nepal to try to do that. So we'll explore that on behalf of the NDA-UK. The second bit was around the securing a job in the NHS, not only NHS, but around the private sector as well. And that one, once you have done the PLAB, that is the second hurdle, and clinical attachment would come there. When I came to UK first time, I came as a clinical attachment. That time for an SHO job, I had already done the FRCS in Nepal. For one SHO job, there used to be about 200 applications. I had to get shortlisted for my first job. I had to apply about 200 posts, I think. So that thing will still be there, but don't give up your hope, and just keep on trying, and you will get the job somewhere. Once you get the job, then Bista covered, Orzo covered about how to build up your portfolio. The portfolio building, don't think that you need to get the job first. You need to start building your portfolio right where you are in Nepal. So as a doctor, what is important that you are a good clinician. You have got a good knowledge for that. You have got skills, and you have got behaviors for that. So those three skills, knowledge and behaviors, those three are the most important. But that doesn't stop there. Unfortunately, there are other things you need to do as a doctor to become successful. And those are making sure you are involved in audit and patient safety and quality improvement projects. And also you collect evidence for that. Getting involved in research, if you get opportunity, that secures you a lot of marks, including publications. Training, teaching, that is very important if you have been involved in teaching. But rather than just being teaching, getting involved in teaching, it's if you have designed a course, or if you have designed the teaching session, that even scores you more marks, as you could see from Bista's presentation there. What is important is, if you have been involved in teaching, make sure you collect that feedback. So how you deliver that teaching, and you have reflected on it, that is very important. So the next bit around leadership and management, the team working, and that is something we can offer from on behalf of the NDA-UK. Please join as members, and once you have joined it, we can help you to build up that team working and leadership skills. And the actual testament is here. All four of the presenters who have been involved today, including Deborah, who has facilitated. We have helped you to develop your management and leadership skills. And then you are part of the executive committee members. I'm so much proud that the NDA-UK is growing, and you are a very important part of it. So you are invited, not now before you do the PLAB or whatever, but then once you pass your PLABs and get the job, please join NDA as members. Not only that, we have 2 medical students here. One Sital, who is studying medicine in, where is it, Sital? I forgot.
In Latvia.
Yeah, in Latvia, and also Prague, who is studying medicine in UCL, isn't it, Prague? So they are the members of the executive committee, and I'm so proud that the younger generation is taking ownership, and we are expanding the NDA-UK. I'm very grateful. Dr. Ramesh Koju is here, our immediate past chairman, who has left a great legacy for us to follow on. So with this, not only leadership and management, but a lot of educational activities, we will get involved as NDA-UK. I'm very much looking forward to it and your involvement. Thank you again for this morning, which I think was a great success. We have recorded this, and Prajwal will be uploading in our website, including YouTube, which can be visible by those who are not able to attend today. Thank you again. If there is anything, I'll stop the recording now, but please feel free to say if there is anything. Paras, you haven't told anything? Anything?
Yeah, I think excellent contributions by everyone. I just want to make 3 points. So for those taking PLAB, you will get the medical knowledge that's given. Just concentrate on your communication skills and respect and empathy to the patient. So I think that's the second part, is which we don't give so much importance, especially in Nepal, India side. So I think that's very important, how you come across in terms of respect and empathy to your patients. And with regard to building your portfolio, just make sure that you record everything and you have some reflection points. Because if you don't record, it didn't happen. So it will be very difficult for you to demonstrate those when it comes to applying for a hospital post later. An excellent presentation. Thank you, everyone.
Thank you. So